inspired me to become a physician was I always had a passion for science and anatomy even as a kid. In my third grade class at elementary school, watched a video on the first open heart surgery. Don't ask me why they showed that to third graders, but we did. And I was fascinated by it. I loved it. I've always been in the STEM classes, the science classes, and really fascinated by the human body and anatomy. I went into college kind of knowing I wanted to pursue a path in medicine and becoming a physician and a doctor, and particularly a surgeon. My education journey to become, an orthopedic oncologist started with a college degree at University of Georgia, where I studied biology and pre-medical sciences. And that took me over to Medical University School of Medicine down in Macon, Georgia, which was another 4 years for a medical doctorate degree. And there I found a passion for surgery again and really found myself drawn towards the orthopedic surgery field. I really liked the hands-on, the ability to make people functionally better and get patients back to a better quality of life. From there, I matched into a residency program at the Campbell Clinic in Memphis, Tennessee, where again, I got to work with amazing surgeons and mentors along the way to get experience into all different fields of orthopedics, but again, found myself drawn towards orthopedic oncology, and that took me to my last year of subspecialty training, where I started at Emory University in Atlanta, Georgia, to complete my 1 year subspecialty training there. I grew up here in Marietta, Georgia. That's where I'm from. I went to Cobb County for high school, and then Mercer down in Macon for medical school. So I was, Georgia educated and raised, and, took a stint up in Memphis, Tennessee for my orthopedic training. But at the end of the day, I was happy to be back home and practicing in my community here in Cobb County and providing care to the people that I grew up with. And it's nice to be back home near my family and taking care of my community. My area of expertise is in particular orthopedic oncology, which also gained you insight into the adult reconstruction world, which is fancy words for total joint replacements. I take care of patients with hip and knee arthritis, starting from a primary total knee, a partial knee replacement, all the way up to the complex revision procedures. And the orthopedic oncology training really takes you into the world of both primary and metastatic bone disease, soft tissue disease. It can affect all parts of the musculoskeletal system, all parts of the body, and allow you to operate everywhere. It allows you to treat patients from children to adults to the elderly. It really provides just a wide variety of patient care, patient surgeries that you can do. And really it just, to me, gave me the best insight in a meaningful relationship with my patients. In the oncology world, the cancer world, a lot of these times, you're with these patients maybe one of the worst times in their life. They come in, they've been diagnosed with cancer. You get to be a part of their treatment plan and go on a recovery journey with them throughout that. And as a surgeon, surgery is amazing. I love being a surgeon. I love what I do. I love coming to work every day and making people better. But the people that get better are the patients behind the scene, and having that relationship, getting to know them, establishing a relationship with them and knowing what do they expect from surgery or their orthopedic management. Not everything needs surgery, so being there and being able to provide them with all of the options and honest and open communication with the patient and being transparent about everything that we can do to try and make them better with or without surgery is still very rewarding, because you can get people out of pain and get them back to functioning and get them back to their activities that they love to do. And for me, I think that communication with a patient and coming up with a management plan for a patient is really a team effort. I, as your physician, can give you recommendations, but ultimately it comes down to what works best for the patient and what meets their expectations in their care. I want a patient to walk into a room and be comfortable asking any question, knowing that they're given honest answers and just knowing that they're being looked after by their physician and that we want what's best for the patient. I think the communication between the patient and the physician is very important, and being able to talk about it and show the patient, images and models of what's going on, explaining all treatment options, starting from, non-operative, most conservative options of medications, therapy, injections, all the way up to surgery. When it comes to communicating with patients, like I said, I am always open and answer all the questions that are given to me. Sometimes patients go home and have more questions come up, or they need a different therapy order or anything like that. And having the Epic MyChart has really been good for patients to be able to reach out to us and send us messages after hours or leave voicemails through our call line. We do have a on-call answering service where there's always a physician available to answer calls. It may not be your specific physician, but it's one of our partners within the Ortho Atlanta system. I treat patients of all ages. With my orthopedic oncology training, again, I am able to take care of pediatric patients all the way up to elderly patients with metastatic disease. And in my adult reconstruction world, I generally treat adults for joint replacement surgery, but I am able to see and take care of patients from young to old. For me, as a surgeon, as I said, surgery is amazing, but I think Part of the patient care that I like the most is the recovery portion. Being able to give them a solution with surgery and get them back functioning again, and just being a part of their journey on recovering and seeing where they go in their life is really important and really awesome for me to see that part of their life.